Today is Monday, the 26th of April, 2021. My name is Adelie Carmichael. I'm interviewing Fatima Suarez for the South Texas Archives at Texas A&M University, Kingsville. This is part of the Voices of a Pandemic Oral History Project in partnership with the Voices Oral History Center at the University of Texas at Austin. Please know, Ms. Fatima Suarez, this recorded interview will be placed in the South Texas Archives at Texas A&M University, Kingsville, and shared with the Voices Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, especially given that your recording may appear online, I will honor your wishes. Also, if there is something that you want to talk about, please bring it up and we will talk about it. Because we are not conducting the interview in person, I need to record you consenting. So I will ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each one. There are 4 questions we need to make sure you agree to before we go on. South Texas Archives at Texas A&M University, Kingsville wishes to archive your interview along with any other photographs and other documentation at the South Texas Archives at Texas A&M University, Kingsville. We will retain copyright of the interview and any other materials you donate to the South Texas Archives at Texas A&M University, Kingsville. Do you give us consent to archive your interview and your materials at the Jernigan Library at Texas A&M University, Kingsville?
Yes.
Do you grant South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville copyright over the interview and any material you provide?
Yes.
Do you agree to allow South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville to post this interview on the internet where it may be viewed by people around the world?
Yes.
Do you grant South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville consent to share your interview and your materials with the Voices Oral History Center at the University of Texas at Austin for inclusion in the Voices of Pandemic Oral History Project, which will include posting the interview on the internet?
Yes.
We have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voices server at the University of Texas at Austin. The final storing of the pre-interview form will be at the South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville. We will have stripped out any contact information for yourself or family members, so that will not be a part of your public file. The public file will only be accessible at the Jernigan Library. Do you wish for us to share the rest of your interview in public file available to researchers at the South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville?
Yes.
On occasion, Voices receives requests from journalists who wish to contact your interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yeah. Yes.
Okay. Okay, now we can get into the interview. I'm excited. So just tell me a little about your experience with COVID-19.
So I was actually living in New Mexico in Santa Fe on a postdoctoral writing fellowship, a dissertation writing fellowship. And I remember when the news first came out that, there was a new virus that was making people sick,
Yeah.
particularly in China. I was like, wow, I mean, I didn't expect it to make it all the way over here. I wasn't well versed in the literature. I wasn't involved in those conversations. So when the pandemic hit and everything just shut down, it was a little bit scary, but also I was in Santa Fe, so there wasn't a lot of people. We were pretty safe. We were pretty isolated, so I thought I was going to be okay. And then my partner, who was in California, lost his job because he works in restaurants, and he was out of job because restaurants just closed, everything just shut down. And I was concerned about him, but I thought, oh, maybe this is gonna be, we're gonna be in lockdown for a little bit, and then everything's gonna open up again. And then I think I started getting really worried and concerned when the previous administration and that was talking, or there were rumors about, shutting down California. Because at that point, the virus was, present in California and Washington and certain states, right? It wasn't present in those states along the coast. And so when that conversation was happening, of course, right, I had my sentiments about the previous administration and and I thought, I mean, can it happen? But with this administration, I realized anything can happen, right? Things that we thought were impossible were now becoming a lived reality. So I got really scared when I started reading about the possibility of closing California's borders. And I thought, well, we don't really know when this lockdown is going to be lifted. And what happens if he does close, California's borders? Like, that means that I don't know when I'm going to come back home. So I spoke with the directors, the heads of the institute in Santa Fe, and I said to them, I need to go home because I am scared that this, administration is going to do something radical and is going to close down California's borders, and I don't know if I want to come back home. And so I remember it was the 7th of April, and I packed all my stuff in my car and I drove for 16 hours. I drove straight through from Santa Fe to Santa Barbara. And I remember I had my gloves on. I would wear my scarf or my as a face mask. And so I got here and I was like, okay, I'm good. I'm safe. I'm here. I finally made it. And then my partner came down a few days afterwards, after I, was here for 2 weeks and I knew I hadn't contracted the virus. So COVID-19 has been a pain in the ass. Like most people's lives, right, is thrown into we don't know what's going to happen, right? We don't know, we can't plan, and I'm a planner. COVID has just made everything so unpredictable.
Yeah, I can totally understand that. It's very havoc wise.
Mm-hmm.
Yeah, can you go more into like your emotions during that time and how it affected you, like knowing that that you were very scared that it was going to go into, you thought it was going to lock the borders of it. Can you go more into that, how you were feeling during then?
Yeah, I was just anxious. I was stressed. I was nervous. And it doesn't help that I was reading all these articles on The Guardian, The New York Times, and The Washington Post. It didn't help that I was reading them right before I went to bed. And so I was really just anxious, nervous. I was really scared because I just didn't know what was going to happen. And I was also nervous. I was also concerned about my partner because he was really sad and upset that I lost his job and he wasn't working. And I was scared about his mental health and his and where he was at, mentally, emotionally at the time. And I knew that I had a little bit more flexibility. Although I was scared, I was anxious, I was nervous, I was scared about what was happening, what was going to happen. I also recognized that I was very privileged, that I was in a research institute. I was living in a house by myself in Santa Fe, and in a very, in a very exclusive part of Santa Fe. And I knew that I had more flexibility, right, of leaving, of moving. And I had spoken, like I said previously, I'd spoken with the folks at the Institute, and they agreed to let me keep my fellowship. So I still had an income coming in, right? It wasn't like my partner or like millions of people who lost their jobs and like, that's it, that's their income. Like, they're not getting a paycheck. I was still getting an income. So I understood that I understood my privileges at the same time that I also acknowledged that I was feeling what other people were feeling, scared, nervous, anxious, stressed, and concerned about what was going on, what was happening. And, we still to this day, we don't know what this virus is. We don't know the origins of this virus. But at that point, it's all new and we're just being bombarded with all this information of what we're seeing happening in Italy and China Um, and it was pretty scary. I was pretty scared, but I think that cushion, that privilege, you know, made me. I probably wasn't scared as maybe most people who didn't have that financial cushion, that financial support.
I know how you mentioned like this neighborhood like type of like fear within other people that don't have as much privilege as you say you do. Can you speak on like your other family members or neighbors that you've seen or have taken in COVID as well?
Like, what do you mean?
Like how they have reacted to it?
Yeah. Well, my colleagues, my friends and colleagues in Santa Fe, I mean, they're all academics, right? We're all academics. So we were consuming, all of this news, all of this research. We were consuming we were reading and listening to podcasts and reading newspapers about COVID. We were looking to see what the scientists were saying, what Anthony Fauci had to say. So we, again, I think, and that as academics, we're still, our jobs can be transferred onto like working from home environment. Like we can work from home. And that transition is a little bit smoother. Not to say that it's easy, but it's a little bit smoother than other people's, working from home or not having that ability to work from home. So I think as academics who are conscious of our position, our social position, and we're conscious of like the resources we had access to, we knew that we were a little bit better off to survive and to live, through the pandemic comfortably, whereas other people who lost their jobs, like my partner. I have other friends who I know who work in food who didn't have to who didn't lose their jobs but were put at risk because they were while everybody else had to quarantine, they had to go and work. And actually, I was among those people because after I came back from Santa Fe and I was in Santa Barbara and my partner came over, I realized, whoa, like, the rent, the standard of living, the cost of living, excuse me, in California is a little bit higher than in Santa Fe. I know I have this income coming in, but it's not going to be enough because he still had bills to pay. I still had bills to pay. So I decided to get a job as a essential worker to support us because my fellowship, my stipend wasn't enough to support us during this time. And again, we didn't know how long he was not going to go back to work. So
Yeah.
it was like, whoa, like, we have some savings, but our money's going to run a little bit and run a little bit out. So I got a job at a supermarket, at a grocery store during this pandemic to be able to financially support us. So it's funny because at first I understood that privilege, right? I was aware of that privilege, but then now I found myself like, oh, I need to go out and work. So during this pandemic, I had both. I had the ability to live on both ends of, I can work from home. My life hasn't been severely impacted by COVID financially to, oh, like I'm finding myself, having to support our family. And I'm actually going to go out and work. And I've never had a job outside of the university, believe it or not. I've never worked outside of a university. So it was like also my first time being outside of a university working in a regular job with just regular people.
Yeah, it's very interesting that you say that actually because I haven't worked outside of university either.
Yeah.
But how do you think it's changed from leaving outside now that COVID has hit? How do you think it's different from pre-COVID, you would say? And
Like my life?
yeah, just going outside in general and like speaking to others or like important events, like if your family hosted any events or anything, how did you go about just basically going outside during this time?
Yeah, I mean, I was, I was concerned, but I also took very precautions seriously. I wore my masks. I would double mask as well. I would carry a hand sanitizer with me. I actually have a hand sanitizer right here in front of my desk. I was very careful about touching myself, my face. So I think I was, because I was, working outside and I was going outside during COVID, I was more careful about about following protocol, about wearing a mask, sanitizing my hands, washing my hands regularly, staying 6 feet apart from people. I know some people to this day have difficulty, measuring how much 6 feet apart is. But I made sure that I was like, I kept my distance from people. So I think following those protocols kind of, helped me kind of like alleviate some of that stress and that, stress or concern. Also, at UCSB, because I live in student housing in Goleta at UCSB, we got tested every week. So I was also had access to weekly testing, COVID testing, which also, gave me a sigh of relief. I put my mind at ease because I knew, like, if I'm taking the proper precautions and I'm getting tested weekly, I'm gonna know if I'm sick or not. So I wasn't scared to go outside. I was just frustrated and annoyed that other people who were going out weren't taking these protocols seriously.
Yeah, and I heard that you're like pro mask and you're for wearing a mask. How would you feel about like going more into that? How would you feel about others that didn't really,
Mhm.
wanted to take those precautions, didn't want to, social
Yeah.
distance and things like that? How did you feel about those people, or did you not really?
I just think that there's such an anti-intellectual sentiment. There's an anti-science sentiment in the United States, and it didn't help that we had an administration who promoted that because they had their own interest at stake, right, in shutting down the economy. Um, and so I just, for example, so at my job at the grocery store, I was a clerk, and a courtesy clerk. And one of my responsibilities was to ensure that people stood in line, 6 feet apart. I was in charge of letting, letting people like, directing the line, right, to ensure safety. I was also responsible for letting people know, like, wear your masks. So there were two incidents where the first incident, I I was directing the line, and a woman and her 2 children passed by me. Now, there may be a relationship, a relationship, and as sociologists, as people who study the social world, we understand why there's that relationship. But they were white, and so they were passed by me, and I said to the woman, ma'am, hi, ma'am, do you have a mask? Can you wear a mask for us? You have to wear a mask to be inside the store. Because at that time, Coletta had passed a mandate, right? So it wasn't just like, please wear a mask. It was like you were required to wear a mask inside private businesses if they were just, it was just a mandate. So I said to the woman, excuse me, ma'am, can you please wear a mask or something like that? You need to wear a mask inside. And she like straight up said to me, no, I'm an American. I'm choosing not to wear a mask. It's my right. And then she just went and started like screaming at me. And I was like, excuse me, ma'am, excuse me. And I was scared because I was like, I'm not afraid to tell this woman, but that's not courteous. That's not respectful. I don't know if my bosses would be okay with me like shouting and getting up in this woman's face. And so this one was just shouting like, I'm an American. It's my right. You're not going to tell me what to do. Da, da, da. And so all of a sudden, this other woman came to my defense. Is like, excuse me, ma'am, like you need to be respectful, like, and start telling her like, it's about respect, you are ruining it for everybody, da, da, da. And then this other man came up. So all of a sudden, like these, like this community of like people like who were like shoppers were like, oh my God, this woman is harassing this courtesy clerk. And they all like came together and was telling the woman like, no, like you are being disrespectful, like it's for the safety. And everybody else was like, oh my God, what's happening? Like, I'm surprised no one pulled out their phones. And so this woman was shouting us like, you're all our sheep for following, and this other man who came to my defense, who was Latino, was telling her like, ma'am, you need to get out, you need to leave, you're being disrespectful and rude. And the woman shouted at him and shouted at me like, you're gonna be sorry. One day you're all gonna be on the train and like leave. So it was just this very violent, verbally abusive situation, all because I asked her to wear a mask, and her children looked so embarrassed. But then I was like, but you're not telling your mom, like you need to like this isn't right. And so that was the first incident. The second incident, I had asked a couple, again, who were white, I asked them, please, can you I reminded them where to stand, because all throughout the line, there were like these red marks where they could stand to make sure that they were 6 feet apart. And I asked a couple, please, folks, please stand on this red square so that we can ensure, 6 feet social distancing. And the man said, hail, and he did a Nazi salute. And so I was like, why is this necessary? Like, why? Like all this energy people are putting into like not wearing masks, not socially distancing. It's like, where is that? What you can use that energy can go somewhere else, somewhere like more helpful, more beneficial, more supportive. So I was just very disappointed, very frustrated, very upset, and but I also understood like these people are just watching Fox News, they're listening to the administration, and they're listening to folks who don't believe in it, because they're in a position to like not be affected by it, right? Like they can be be socially distant, they can work from home, they can and if they get sick, of course they're gonna get exquisite medical attention. Like, so I was just frustrated. That's my feeling.
Yeah, that sounds very hectic to deal with that. I could never imagine myself dealing with that, and like there are different, ideologies with those things,
Mhm.
It just blows my mind that you went through that.
Yeah, yeah,
Um,
and it was like, people, it's just about respect, right? It's about respect, and it's about understanding that we live in an individualistic society. We live in a society that values the individual, that is about individual rights, that is about individual, success, that it's about the individual, right? It glorifies the individual. But I think the pandemic, if it's taught us anything, for those of us who are willing to learn and willing to listen and pay attention, it's taught us that we are more connected than we like to think we are, and that it's a public good to be it's important, and it's just to be considerate that your actions, how you behave, can affect the lives of other people around you, right? If you don't wear a mask, you are putting others at risk. If you're not socially distancing, it's not just about you, but your actions have consequences on the lives of other people. um, and that we're all connected, and that we're all, we should all look out for the well-being of each other, which is why we should have like access to universal health care, right? Because in this situation, right, if you're sick, because of how interconnected we are, you being sick can make all of us sick, as we saw in the pandemic. And so I think if the pandemic has taught us anything, for those of us who are willing to learn and listen, it's taught us that we're not individuals, and that we are so intimately connected, more than we like to admit that we are, and that our actions have, dire life and death consequences on other people, whether we, and of course, where does that leave us in the conversation of individual rights? Yeah.
yeah, that's very insightful. I would say that it would be more science-based, and it's just human compassion, honestly,
Mhm, mhm,
basically.
I agree.
Has COVID in any way changed the way that you've received your education or messed with your education in any way?
I mean, when COVID hit, I was at the point in my in my education program. I was writing. I had just in 2019, 20 actually, no, early 2000, no, 19, 19. In early 2019, I had finished data collection, so I wasn't going to people's homes. I wasn't meeting people in person to do interviews with them. So I had finished data collection in 2019, and by the time that pandemic hit, I was just writing. And writing is solitary, right? Writing is solitary work. You're just at your desk and you're writing, you're thinking. And so it didn't disturb my research because I had finished collecting data and I was just writing. It didn't, and I wasn't taking classes. So I didn't have to do the transition to like online learning. I did teach last summer a course during our summer session. And so that was the first time I had to teach online and learn how to work Zoom and, rely on, our like learning websites and stuff. And that was really different because I really missed being in the classroom and interacting with students and teaching in person. I mean, it's just teaching in person it's just teaching online does not compare, right, to teaching in person. So I had to teach online, and that was interesting. That was different. I had to learn how to work Zoom, and I had to learn how to like be even more charismatic and engaging online than in person. So I think in terms of my own education, it didn't necessarily affect it in terms of like me going to class or me writing. It did affect how much time I had to write because I was working, and I was working at a grocery store for part-time. And so that was half the time taken away from my writing, and then teaching online, which was my first time teaching online.
Do you want to go into more of like your teaching online and like the difficulties you faced during that time?
Yeah.
Switching to like an online platform?
Yeah, I mean, I'm really bad at reading emails. I'm really bad at online stuff in terms of like, working, learning all the, glitz and glams and knowing all how to work it. So I underestimated how complicated Zoom can be. So I remember I was and thankfully I had two TAs who had been TAing and teaching during the pandemic. So they knew, they were already kind of comfortable with Zoom. They were comfortable with like how to record lectures and upload them on our learning websites, which we call Gaucho Space, but you might all call like Blackboard and stuff, or like Canvas or whatnot. And so I remember I was teaching online the first day of summer session A, and I kept, I'm a perfectionist. I like, in my head, I plan about how my lecture is going to go. So as I'm like lecturing it to students, I find myself, I have to like stop and like ask my TAs, how do I share screen? And then people are, people are telling me, oh, my friends are in the waiting room and they're waiting to be admitted to Zoom. I'm like, what is that? And so like my TAs had to be they had to be very patient with me. And I kept, lecturing or, doing my introduction thing and then stopping because people are like chatting, are sending me chat messages during the chat, and I'm lecturing and I'm like, I can't do these two things at once, people. And then my TA is telling me like, Fatima, like there's people waiting in the waiting room. I'm like, what is a waiting room? Like, it's just, so I had underestimated Zoom, and I was not prepared to teach the first day because I had not studied Zoom, because I thought, oh, that must be easy. And then I was like, oh no, it wasn't. And then, so it's just learning a whole new system, right? Learning a whole new online system that I wasn't invested in learning it, because I was like, oh my God, I'm so anti-online teaching, but I guess I have to do this. And just learning learning on how to navigate Zoom. That was interesting. That was challenging for me in terms of online teaching, and then not having that interaction with students, And I kept telling, and I was also debating about, should I have everybody turn on their cameras, right? Because some people, when we're in college, right, there is a sense of equalizing, right? Because you all are sharing a dorm room. You may have, you and your dorm mates or, other people might have different things that you might have at different like products and stuff. But you're technically like all the same. Like you're in the same dorm room, you're in the same building, you're eating the same cafeteria food, like, but now with online teaching, right, you actually get to see the inequality, right? Because of where people are, are zooming in from, whether it's their family's kitchen, their closet, their rooms, if they have their own rooms, from their cars, from their workplaces. So I was concerned about, like, if I have everybody turn on their camera so I can actually see who I'm talking to, they can also see like the inequality, right? And like who, like, and so so some of the ethical kind of questions and issues about online teaching were also challenging, because at one point I want the interaction, I want to see who I'm talking to, but on the other hand, this is all structured by inequality. And so I think that was also difficult, challenging for me to do the transition to online teaching.
Yeah, that's very interesting that you really noticed that, because a lot of my professors sometimes will say everyone turn on their cameras, but like, the families that they live with, the background noises and all of that. Did you require them to turn on their cameras, or did you just let them do whichever? Or
So at first, I had them turn on all their cameras, and then during the term, I said, you don't have to turn on their cameras. And also, some students don't have cameras, and I was like, oh my goodness. So I asked them. So I came up with this kind of compromise about everybody upload a picture of yourself as your profile picture. So when your cameras turn off, I at least see a picture of who you are. I just do that, and don't upload a picture like, this like very Photoshop. Just upload a picture, just so I can see who you are. A recent picture, not like 10 years ago picture, so that I can at least know, have an idea of who I'm talking to. So that's kind of like been my my approach from now. Just turn on don't turn on your camera. It's okay, but just at least have a picture of you so I can see your picture.
yeah, for
Mhm.
sure. For sure, it like breaks down that social like dynamic that you would have between like students and professors. It just
Mhm.
but do you want to talk more about that? How it broke down like the social dynamic of like how it's different, how it
Yeah.
socially.
Yeah, well, I mean, I just don't talk to students, right? And students don't talk to me. And so my office hours are less busy, which some people would say, yay, but I kind of use office hours to meet students, for students to get to know me, so that they know like my approach to teaching, so they can get to know me on the like in human level. Um, and so with online teaching, I just meet out of 90 students that I have in a class, I probably get to know 5. And those 5 are the people who email me frequently or who come to office hours. So, and it changes, right? It changes the dynamic, because when you're grading, you see, and you're grading people's like work, you'll know, oh, I know so-and-so, and I'll read her work maybe differently than I do when I read so-and-so's work, who I've never met, who I forget is in my class, who's never been, reached out or whatnot. And that's just what it is. That's what human interaction does. So it kind of like, it just dehumanized everything. But also, students, because they don't see us, because they don't hear us, they're not having that human contact. When they're upset, or they're displeased, they'll email you like someone who's commenting on a YouTube video. It's very nasty. It's very like, and I just keep asking myself, like, do students read their emails before sending it to us? Do they write them in the heat of the moment when they're really upset about their grade? and they just came across as really disrespectful and entitled and rude and da da da. And so students, I find, and I'm finding now that I've had like a year of teaching online, is that students are displacing their anger because they're frustrated, they're angry at the situation. You know, life is happening, COVID's happening, they're upset, they're angry, they're frustrated, and they're displacing that anger at us, and they're directing it to us because we're easy targets. And so I think that I've seen that more, and I think that breaks down, you know, going back to your question about the dynamic between the teacher and the professor and the student. You know, students are now, I'm finding in my classes as a TA and as a professor, that they are a little bit less restrained when they reach out to us and then when they email us. And I think that's, again, that's what happens when you want to have contact. When you write something, you send it into cyberspace, but we forget that there's a human being at the other end of the monitor. And I think that's what's changing a lot. That's what's really, at least in my experience, that's what's changed because of online learning. It's just this lack of empathy, as you said before, and there's just lack of consideration and just this like anger displacing, because we can't displace it to COVID, right? But we can surely direct it to the people who we in the moment are making our lives difficult as we think they are.
Yeah. So you say that you've been pretty understanding to students that are just very angry, would you say? How do you think other TAs and professors have handled it, or do you think that they're stressed with their students becoming this way?
Yeah, I think there are two reactions, right? One, and which is the reaction that I'm having, and the last two instructors with whom I've worked with, they have the same kind of approach, is that we are considerate. We will be flexible if students reach out to us, but we're not going to lower the standards. We're going to still expect you to do your work because you're still earning college credit, though we are open to more flexibility. We're open to giving you more time if students ask us, if students let us know that this is what they need. And so there's folks who are, including myself, who are like, we will still hold you accountable to the same standard, the work, you will still be expected to do your best work. But if you need more time, or if you need more flexibility in getting that and giving us your best work, we are open to giving you that extra time if you ask us for it. And then there's other groups of faculty who are just like, we just don't want to deal with it, who will be like, all A's, let's give everybody, let's be all easy, let's give everybody A's, let's lower the standards. One, because they may believe that that's the right thing to do in a pandemic, or they might believe that, you know, I just don't want to deal with it because I am also living through a pandemic. I'm also stressed out because I have kids at home and I have to teach them as well. My, you know, parents, or I know people who've died from COVID, like they just might be so overwhelmed in their own lives because of COVID as well, that they're like, I just don't want, dealing with students is the last thing I want to do. So I think that that's been the kind of the pattern of response that I've seen from my colleagues. We're going to maintain the standards. We will be a little bit more, we will probably adjust how much work we give you, but you will still be expected to do good work. But if you need more time, if you need flexibility, if something happens, reach out to us in time. And then there's the other group of folks who are like, I just don't want to, there you go, easy. You know, I just don't want to, I don't want to deal with student complaints. Yeah.
Yeah, okay. Has your campus or like college community, have they been giving back to the community, or have you seen like any more strive within your community to help out with others during this time?
No, I think, you know, having this weekly testing, COVID testing, I mean, they're spending so much money on that. I don't know how much money they're spending on that, but it's pretty a lot. I'll be offering all of your students and staff, everyone, COVID tests every week. But in terms of the community outside of the university community, no. No, I haven't seen that, no.
That's pretty surprising. Like
Mhm.
me neither. Like I haven't, it's surprising because you think everyone would, try to help out each other and actually do some things,
No, they haven't actually. And I think it's because they're just, so focused on how do how do we ensure or how do we guarantee that online learning is the same as in-person teaching, which isn't, right? But I think they've just been so overwhelmed with how do we maintain, the line? How do we, dealing with students' complaints and parents' complaints and like faculty complaints. And it's like, I just think that they're so focused on in-house issues and with getting students back to campus, getting people back to work, that they're just not engaged with the community at all.
Yeah. Well, that makes sense as well because I think people have like an internalized and a lot of fear with going out,
Yeah.
Can you tell me more about your job that you took up and
hmm
like when you took it up and how that has impacted your how you've been in college and then also you're working as well?
hmm Yeah. So, yeah, I mean, I arrived on a Tuesday and I started work on a Wednesday. I was actually driving from Santa Fe to Santa Barbara to Goleta when my manager called me and said, "Are you still interested in the job? Do you want to come in tomorrow?" And I was like, "Yes!" And as I was driving here, so I started April 7th. Yeah, I started April 7th, and it was, I was working 4 days out of the week because they were really understanding. I told them, these 3 days, I need I need to be off because I need to write my dissertation. And they were very understanding of that. So for three, I worked 4 days out of the week. 3 days, Monday through Wednesday, was just my writing days, and I was really protective of those days. Um, and as a courtesy clerk, I was bagging people's groceries. I was collecting and sanitizing carts. I was sanitizing all the handles in the store. I was sweeping. I was cleaning the bathrooms. I was just doing all the sanitation work. And and I met people, right, who, man, I met real people. And not to say that people in the university aren't real, but I met people who, like, this is what they do for a living. And it was very humbling experience because I met people who, like, they were doing this because this was their living, to make a living. They were doing this for so many years. And yeah, I was really humbled by them. And they looked at me and they asked me, "So what do you do?" Like, and I said, "Oh, I'm a student." "Oh, like, oh, what year are you in?" I said, "Oh, well, I'm a PhD student." And they were like, "Oh." And so I got these looks like, "You're working here?" Like, and
Yeah.
I once, one of my coworkers said to me one day, "Are you studying us? Like, is that why you're here? Are you doing a research on us?" And I said, "No, but that's a really good idea." Researching like essential workers during the pandemic. But no, like I was there. Like, they said, "Yeah, like, are you here to study us?" Like, because they just couldn't understand why I was there. But it was very humbling, cleaning carts and, bagging people's groceries. I mean, and of course, right, customers didn't know who, like, what was I, what I did on my time off. But I have a huge respect for people who do these jobs, who are restaurant workers, who are, grocery workers. And man, like, it's tough too. It's a tough job. I remember the first day, few days, I was like, oh my, I was so tired. And I was so sore because I was on my feet all day. And I've never been at a job where I've been on my feet all day. I've been sitting, which is why I have back problems. I mean, those of us who work in university, like we who are like do academia, like we have other health issues because we're sitting down, we're sedentary. But at this point, I had the opposite effect. Like I was standing all day, walking all day, where I just thought, oh my God, I can't wait to sit down. Um, but my coworkers at the store, at the market, humbled me. and taught me just the value of hard work. And, again, it gave me a sense of self-awareness that, I had before, but it expanded it. This self-awareness about, wow, like I am very privileged. And understanding that not everybody has that. And so now every time I go to grocery stores, like I am very respectful, do not give anybody an attitude. You don't have something on the shelf, all right, I'm not gonna ask you to go into the back and look for it. Like I am just very considerate of people now people who work in those type of jobs. And it makes me realize, wow, like academics were not considered essential workers during this time, and the people who are at the bottom, right, who are, service workers were, and they had to be the ones to risk their lives to like keep going to work during this pandemic. So it's just a little humility.
Yeah, true. I find it very like remarkable that you're so like optimistic about it. Did you ever like become fearful that you did a lot of sanitation during this time? Or do you think you weren't really fearful of that? Interacting.
I wasn't. I was upset that it was the women who were doing it and not the men. Because all the men would never, like the male courtesy clerks, they didn't clean the bathrooms. They weren't sanitizing carts. It was the women, right? And so I brought that to my manager's attention, like, there's a little gender imbalance here. There's, and it's not because women like to clean, but it's this whole gender kind of, approach and attitudes and behaviors. Like, no, men should be cleaning too. So I wasn't scared because it was a pandemic. I was upset that the men were doing it. Why is it all the women who are cleaning and not the men? So the men were always bagging groceries, but the women were always cleaning. No. Yeah, so I was upset by that. I wasn't upset because I wasn't scared about the pandemic. I was upset about the gender imbalance.
Yeah, I can see that too, though.
Yeah.
Did you have any, like, you said you had like some financial issues, that's why you had to take on the second job. Do you mind going more into those?
Yeah, so when one of the conditions of the folks at Santa Fe letting me go and letting me, come back to California was that, well, still, their condition, they allowed me to keep my fellowship stipend, so they were still paying me for my fellowship, but I still had to pay rent for the apartment house that I had over there. So I was paying rent for two places. I was paying rent here in Goleta, which is expensive. It's, high cost of living here. And then I had to pay rent for the apartment in Santa Fe. Even if I stayed in Santa Fe, I would have still been paying rent for this place here, but I wouldn't be living here. So I wasn't going to escape the fact that I was going to be paying for rent for two places. And I've always lived by myself. I've never, in my adult life, I've never had a roommate. And if like the first year of grad school that I had a roommate, like we didn't share expenses. It was just individual. We were responsible for our own individual expenses, but it's very expensive to live with someone. It's their food. You're spending twice as much money on food that you used to. You're spending more money on like just like household products like toilet paper and shampoo and stuff. I'm like, oh, I don't remember it being this expensive to live here, And he had his own bills that he had to pay. Keep paying for, and he could have like stopped paying his car payment, but they were still going to charge him the interest, and he was going to still pay even more at the end. So he decided, you know what, I'm not going to ask for a payment because I'm still going to be responsible for paying that afterwards. So we just had, those bills. I had my own bills, like my credit card bills and stuff. I'm also paying back my student loans. And I always tell students this, like, please start paying back your student loans while you're still in school, please, something I didn't do and I'm totally regretting it now. And so we just had bills, and it was expensive to live here, and I was paying for 2 rents. So and we were also saving for our wedding, which we're not having. We're not having the wedding we wanted because of COVID. We're actually eloping on Saturday. And so yeah, so it was just, we couldn't live together on just the stipend that I was getting.
Do you want to go more into like, you said you had to like postpone your wedding?
Mhm.
Do you want to go more into that and like how you felt about that?
Yeah, I mean, we started planning we've been engaged for 2 years now, and we were planning our wedding. We were saving up, for the year. And then, we were planning, and we were hoping that by May this year, the pandemic would have been, would have been done, that we would have been in a better place. And so we're planning it, and then January comes. And we're seeing that the number of people who have been vaccinated it's not a lot of people, because we were told that, a million people or whatnot were going to be vaccinated by December, and that didn't happen. And then the variants came up. And then, so we're in January, we're still like, we're still planning, we're still hoping to have our wedding like on the 1st, but the news about the variants was coming out, the vaccinations weren't happening, they were not speeding up. So we were a little bit concerned. And then it was late February, when we decided, you know what, we're going to cancel our wedding, because we're not going to be at a better place in May. Vaccination rates are still low. The variants are coming up. It's just going to be very difficult for people to travel to California. So we decided to cancel our wedding, but then we were like, but we want to get married. So we decided to elope. So we're going to Las Vegas on Saturday. We're getting married on Saturday there, and it's just going to be us two. And we're broadcasting the ceremony on the internet for people who couldn't come. So it was difficult because we had already paid for so many things. So I have all these like favors, and I'm like, what am I gonna do with all these like wedding favors? What am I gonna do with like a cake plate and a cake server? Like, you just spent. And then I bought a dress. I had a dress already for a year now, wedding dress. And then because of the pandemic and I was working, that's another thing, like, because I was working at Albertsons and I was on my feet all the time and I was working, like I lost a lot of weight, because I was like always on my feet walking and stuff, and I wasn't eating as much. So I had to get another dress because the old dress didn't fit anymore. It was just more expensive, it was a little bit more expensive, and a little bit more, it was a little bit more stressful and sad that we couldn't have our guests there. So it's just going to be the two of us when we're looking on Saturday.
Yeah, well, congratulations on
Thank you.
marrying.
Mhm.
But yeah, do you want to go more into your mental health during COVID-19 or how it impacted you?
See, and that's an interesting question because, I mean, like I didn't have kids at home, so I wasn't, always constantly like with kids, and then going to school and online and stuff. So I didn't have kids. I mean, I was working, but I don't know. I don't think, like, I was not depressed. I was not. I didn't have these like very, because some students who reached out to me, I mean, they've been struggling with this pandemic. I don't think I've had those struggles or those difficulties with being in the pandemic. Again, because of those privileges, right? I live by myself. I'm in charge of my own schedule now. I'm working, yes, but it's give me something to do. Like I just didn't, and I was working, like at first I was working to support us, and then he went back to work, like the restaurant's open, but then I still kept working, just so that we can save a little bit more money. So I was stressed like, everybody else, but I wasn't, I don't think I experienced the struggles that so many of my students have about with the loneliness and, the sadness of not being in school and not being around people and having to be in your whole house and with other people, family members, and not having a space to call your own to like do your work and concentrate and focus and stuff. Um, so I did better than most people, and I think part of it is because of the resources that I had access to.
Yeah, totally. There is like a lot of people that have struggled very much with COVID. And you said that some of your students have been impacted by it. Could you like kind of reflect on how, I guess, other people have struggled with it?
Yeah, I mean, no one in my family has died because of COVID. Um, I know that my next door neighbor, the neighbor that I grew up with, in my family home, she died from COVID. Um, and their family got COVID. But my family, my immediate family, my mom, my dad, my siblings, they didn't get COVID. They haven't gotten COVID, thankfully. My parents both are now vaccinated. Um, and my other extended family too, no, I haven't heard of anybody who got COVID, who's died from COVID. So, I mean, if we're talking about like real, like dark, dire impact, death, a lot of people have died from COVID. And I've been very fortunate, blessed, but also privileged, I think, to not have had family die from COVID. Um, and I think that, some of my students have lost their families to COVID, or have lost family members to COVID, excuse me. And I mean, how do you bounce back from that? Especially because, this, they were healthy, but it was until this disease that, they passed on. So I think that has significantly impacted the mental health of my students and of other people that I know because, having a death in the family because of COVID. And so I think that's why I haven't, because there hasn't been no death, and I haven't been impacted in that way, like some of my students.
I also did want to ask, do you still receive like appropriate health care, and have you been vaccinated?
Yeah, that's another thing. So I have I have health insurance with UCSB, and the student health has been open during this whole time, so I've been able to get go to the clinic. I have been fully vaccinated. Like I said, I've been getting tested weekly for COVID. Thankfully, knock on wood, I haven't had COVID yet. My partner hasn't had COVID yet. And I was really scared for him because he's a cancer survivor. So his immune system has already been impacted by his disease. And he's also been he's fully vaccinated now. Yeah. So I've had access to health insurance and weekly testing, and I'm fully vaccinated.
That's good. You keep mentioning your partner a lot. Would you want to speak more on him, about him for a little bit?
Yeah, I mean, he's a wonderful man. And I mean, we got really close during the pandemic because he came down here and he was living, we were living together for about 2-3 months before the restaurant opened. He went back to work. And the traditional gender arrangements were totally switched because I was working and he wasn't. And he was at home, cooking, cleaning, exercising, going on walks. And I was the one working. And there were moments during those 2 to 3 months that it came up. And he was struggling with that because, being a man is having a job, being able to work. Like work and masculinity are so intimately connected. And so when men don't work, is as if they're not men, right? It severely impacts their masculinity and their self-worth. And so my partner, my fiance, he would have his doubts of am I good enough? What would people say if they found out that I was being financially kept or supported by my female partner? He was having his own struggles about, am I worthy? Who am I if I'm not working? Like, what do I have to offer if I'm not working? And that's a significant like social, psychological understanding among men, which is why when men are unemployed, I mean, it severely impacts their mental health and their sense of self-worth as men. And it's interesting because while he was doing that, he was going through his own like struggles about reconciling the fact that, he's at home doing all the work in the home, and then I'm not working, getting paid. And I've had housework is real work, women don't get paid for it because of patriarchy. It is real work. You are supporting me, because he would go and pick me up and drop me off work. He would take me lunch to work. I would come home and the house would be clean and there would be dinner ready. And I'm like, oh man, no wonder men are like this so much. They're being taken care of, and I'm like, oh, I'm being taken care of like a man. But like at the same time that I was living this struggle with my partner, and reminding and witnessing him go through his own like understanding, like re-understandings of himself as a man. It's the same thing that I was studying, right? Because my research is on Latino fathers. And so I was living my research with my fiance, which was interesting because as I'm researching, Latino fathers. I'm writing about work, because work is such an important part of fatherhood. As I was writing and thinking about my participants and my research, I was living it with my fiance, assuring him that he's still a man, that your masculinity is not related to whether you work and you are a provider, but it's really hard to tell men that being a provider is not all who you are. And so my partner and I, we went through like a growth. We grew together. But he's taught me a lot about humility and about just being grateful for what you have. And yeah.
Yeah, there's definitely a big stigma around like toxic masculinity and having to fit into those norms, definitely. How would you feel about like the current social movements in conjunction with COVID-19 that have been happening recently?
I mean, of course they're going to happen right now because the conditions are ripe. The conditions, you have massive unemployment, you have a pandemic, a global health crisis, you had a political crisis. So the conditions were right for a movement because now you have all these people who have nothing to do, right? Who are not working, who are at home, who are consuming media and record numbers, and who are upset and are pissed because of because life has taken a turn, and what we thought was normal is no longer that. So the conditions were ripe for massive mobilizations, the mobilizations against police brutality, the Black Lives Matter protest, the anti-mask, anti-lockdown protest. I didn't understand that, but I understood where they were coming from, but I didn't agree with how they framed it. Because I think this would have, and we did get, economic relief packages, but this would have been like people who were protesting anti-lockdown, anti-masks. What they should have done, they should have framed it as like, we're upset not because of the lockdown, but we're upset because we're no longer working. We had to close our stores. We're no longer like providing for our families. This is the moment for like an economic revolution, right? Like a whole like systematic revolution of capitalism. But they didn't frame it like that. They framed it like, I want to wear my mask, my body, my choice. I don't want to get vaccinated. I don't want to like lock down. The government is infringing upon our rights. Like they took the traditional route and taking it as the system was not built to support us during moments of crisis, because the system is in crisis. This would have been the time to advocate, to like come together for universal health care, for a universal income requirement, like minimum, for like, this would have been the time to get like a new deal, which we kind of did, but it could have been more. We could have had more if people would have just reframed their grievances.
Yeah.
But I was glad, but I kept saying to myself, just wear your masks. Just wear your masks. Just that's all I want. Just wear your masks, have some hand sanitizer, and go protest safely. So those were my thoughts.
Yeah, definitely, for sure. Because the wearing a mask and sanitizing and making sure that you're taking care of others, really, it's all based in science. It's what
Mhm,
experts are saying. So,
mhm.
yeah, I totally agree with you.
Yeah,
Um,
yeah, and I understand. I mean, I live in Goleta, and Isla Vista's had so many cases of COVID because college kids are just partying. They don't care. They think they're young, and it's not gonna kill them, and it's not gonna be a big deal. And I get it. I understand why young people are frustrated, right? Because especially college students, because it's my time in college, like high school students. We were supposed to go to prom and grad night, and I always tell them I was supposed to get married. I'm graduating. I'm getting my PhD. Things in my life. 2021 is a big year for me in terms of my life, my professional and personal life. And I've had to like adjust my expectations, and be okay with maybe not having a graduation ceremony, maybe not having a wedding that I wanted. But I just got to count my blessings at this point, right? I can't be upset because that's just energy that is being wasted on something that I have no control over. I have no control over people's actions. I have no control over the pandemic. I have no control of the political leaders. I do have control over my actions.
definitely. Did you take part in any social reform movements or not?
No,
Were you? No. Okay.
no, no. I mean, I think I just didn't have time.
Mm.
I was working, and then I was also in the job market, and I was teaching. No, I did not. I did donate to several organizations, who were supporting protesters. Um, I donated, but I did not participate. Yeah.
No, I think we've covered a lot during this interview. I'm going to wrap it up a little bit. I was just wondering if there is anything else that you wanted to cover or share with me
Mhm,
before
mhm.
closing, or anything that you really wanted to talk about that we didn't really cover.
No, I think we covered a lot of ground here. No, I think, yeah, I think we covered a lot of ground here. So I have nothing else to say.
Okay. Well, I wanted to thank you very much for your time.
Mhm. No, thank you so much for inviting me to participate. Um, I really enjoyed it. I hope that my story supports and adds to the archives, the collection. Um, yeah, I think we're in a very particular moment in history, and we now know who we are, right? Who we are is revealed in a moment of crisis, and there's some of us who are able to like power through and go through it and survive through it, but there are others who are just they're just they're not who we are. They're different people, and yeah, like we reveal who we are as ourselves, as our society in the moment of crisis. And I don't know if I'm too happy with who we are as a society in the moment of crisis.
Well, thank you very much for your time. It was a pleasure interviewing you.
Thank you so much, and have a great rest of your day. Enjoy Florida.
Thank you.
And,
Enjoy your day too.
thank you so much. Take care.
Okay,
Bye.
bye.